Hi everyone, I'm going to be doing Chapter 16, and Chapter 16 is about public health quality and improvement in practice, and moving beyond quality assurance. So basically, as demands on the U.S. public health continue to increase, QI strategy may play a vital role in supporting the system and improving outcomes. The key quality that I'm going to assess in this chapter is on page 475, and I'm going to be talking about quality improvement in state agencies. So, the two state agencies that they list in this chapter are Washington, the State of Washington Department, and North Carolina. So, to start, for Washington, quality improvement initiatives began in 1999, and at the time, data revealed that the quality of care for diabetes patients in outpatient settings was surprisingly poor and differed substantially from evidence-based practice. So obviously this is a challenge that they decided that they needed to conquer. And in response to the data I just shared with you, the Department of Health funded staff from several clinics to attend an IHI chronic care model collaborative. After the success of these clinics, the Department of Health sent several of its own staff to receive extensive quality improvement training from IHI to continue and expand this effort. So this is just one example of the Department of Washington and how they basically use quality improvement efforts to initiate change. Oops. And then in 2006, the National Immunization Survey showed that Washington State's immunization rate was 71%, and only 36% of children living in Washington had up to date immunization records, which is again another challenge and another reason why that they began their initiatives in Washington. And they conquered this challenge by bringing together 3 local agencies, which are listed in here as Spokane Regional Health District, Snohomish Health District, and CHILD Profile Immunization Registry, to collaborate on a quality improvement project. And they named the project Immunization Reminder Recall Project in 2008. So they designed like 3 goals. They decided to increase the proportion of 19 to 35-month-old children who are fully immunized in provider settings. 2, increase the amount of data in the immunization registry. And 3, increase providers' use of the registry. And during this 15-week project, they collected from 2 pediatric practices and 1 family medicine practice, and the results were that obviously the project increased the proportion of 19 to 35-month-old children who were immunized, and it improved the data and the use of the registry. So that's it for Washington. And as for North Carolina, like I previously said that I was going to talk about, North Carolina was the first state to pilot test state accreditation, and it was the first state to statutorily mandate statewide accreditation for local public health agencies. I'm going to read a little bit here. Yeah, so like I said, they were like the pilot test for that, basically, and the North Carolina Division of Public Health, NCDPH, identified numerous areas of improvement, and basically improving communication, integration. At the time, the state director, in collaboration with 5 NCDPHP, was charged. So basically, the NCDPH and local public health agencies were unable to launch and implement quality improvement activities at state and local levels without significant support, which was obviously, that's why I'm stating is it was a challenge. And so basically a way that they came to conquer that with their quality improvement strategy was to get several partners involved, which they did in 2008. And I'm on page 476 going on to 477. So the goals for the first 3 years are to provide quality improvement training for more than 50 local health department teams and more than 5 NCDPH teams. Providing ongoing technical assistance for quality improvement teams. Create a robust interactive website. So basically these are all quality improvement strategies that they were creating. And lastly, create an NCDPH statewide local health agency dashboard, which is awesome. And this was in 2008. The NCCPHQ trains public health agency teams experientially through a 6-month training period. The program teaches them lean improvement, which we've actually discussed in previous chapters, and the model for improvement, which is a quality improvement method that focuses on the 3 simple steps of measure, test, and implement, in short. And basically, for the remaining of this chapter, it just goes to show that it was successful. North Carolina was successful in implementing those 3 goals, like I previously stated, on 477. And basically, in conclusion, the NCCPHQ illustrates the key components of CQI infrastructure, including links to the organization's strategic plan, support, and guidance from the organization's top leadership quality improvement training programs for staff, a mechanism for prioritizing quality improvement projects and launching quality improvement teams, staff support, and motivation for quality improvement activities. So basically, that is all I wanted to share with you. And once again, what I talked about is from 475 to 478, that top paragraph. Thanks for listening. And if you have any questions, just write them in the discussion board, or, you can email me. Thank you so much. Hope everybody's staying safe. I went over the time. I'm sorry. Hope you enjoyed it. Sorry I stuttered. Just started again. Alright, be safe. Bye.